If you have never had a baby before, well, actually, even if you have had a baby, you may be wondering, what happens after my baby comes out of me? Welcome to What to Expect Postpartum. So you've had your baby, and then you would have had some assessments done and maybe some perineal repairs done over in labor and delivery, but welcome to postpartum. Now, at some sites, the postpartum unit is completely separate, and at other sites, it is all in one. So it is labor and delivery and postpartum. But regardless of where you give birth, you are now entering the immediate postpartum period of your childbirth. And we don't just forget about you when you come to postpartum, right? We still have lots of things that we are assessing. They just might not be assessed as often as they were done in labor and delivery. So off the top, you can expect us to assess your vital signs. So your blood pressure and your heart rate and how fast you're breathing and your temperature and your oxygen saturation. Now, depending on where you're at, this might vary on how often it's done, but very commonly this is at 2 hours after birth, at 6 hours after birth, at 10 hours after birth, and then once per shift until you go home. But that is not the only thing that we are assessing for you right away. We also want to know, what is your uterus doing inside your abdomen? And yes, that means we do have to push down on your tummy right after you have had a baby, and this can be uncomfortable, but I want to remind you, this should just be a fundal check. This should not be rough fundal massage. And you can tell your nurse that I told you that. It should just be a fundal check. But it's important because this serves as a postpartum vital sign. It tells us how your recovery is going, but it also alerts us to any potential problems that might be on the rise so we can intervene before they become a much bigger problem. So we are looking for, where in your abdomen is your uterus? Is it in the middle? Is it left or is it right? Is it rising or is it coming down in your belly? And is it soft or is it firm? And we also want to know how much flow is coming out of your vagina. Now, I do have a small video on flow after you have a baby, but please let me know if you would like an updated, longer version of that video. Now, obviously you do not come alone because you're part of a partnership now, so we also look after your baby. Now, your baby would have had a couple of checks done over on labor and delivery, so we are gonna pick up where they left off, and we're gonna start with a head to toe assessment. I'm gonna make sure your baby has all their fingers and all their toes, and then look into their other major systems as well, and we're also gonna do vital signs on your baby, which are very similar to yours. So we're looking at how fast are they breathing, how fast is their heart beating, and what is their skin temperature. Now, these checks on baby are done around 2 hours of age and 6 hours of age, and then once per shift until they are discharged home. And you might realize that is very similar to the checks that we do on you. And that is because we really should be blocking your care together so that you can optimize the amount of rest you're getting in between interruptions because you just had a baby. So you tell your nurse, block my care together so that I can get lots of rest. You can tell them that I said that. My name is Tina. I am a labor and delivery nurse, and I have my certification in perinatal nursing. Now, if this type of content interests you, I urge you to boop that subscribe button so we can learn together, because I love it when you're here. Now, these checks on baby are often done more regularly if there are concerns for baby's health. So maybe they were skin to skin, but they were making some grunting or some gurgling sounds, and we want to make sure that they are going to transition okay. Or maybe they had a forceps or a vacuum delivery, and we want to keep a closer eye on them. Or maybe you were on some medications, and we want to make sure that it's not going to interfere with baby's ability to transition to the real world. So, of course, one size fits all care is not appropriate here. We are going to tailor it to you and your baby. I talk a lot about breastfeeding on this channel. So if you're planning on breastfeeding this baby, you're going to want to try to get them latched within that first hour after they are born. So a lot of times this happens over in labor and delivery. And when you come to us, we're then going to work at practicing breastfeeding. And remember this, if you have never breastfed before, of course, this is all going to be new to you, right? But even if you have breastfed like 5 other babies, this is still going to be new because every baby is different and every breastfeeding journey is different. Please don't forget that. Now, if you have not latched your baby when you get to postpartum, that is okay. We are then going to work at your baby's latch and establishing breastfeeding. So a lot of what you can expect in postpartum, if you are a breastfeeding parent, are lots of assessments and lots of education by your nurses. So they're going to want to observe a breastfeed so that we can see, how are your breasts doing? How are your nipples? How's your baby's mouth? How is their latch? Is there milk transfer? Is there colostrum? We want to see it all so that we can help you to be successful. Now, here is a video all about getting a really good, efficient, deep latch. If you want to watch that before you head in to have your baby, it might give you some tips that you might want to know. If you are formula feeding, your nurse is going to want to help you establish a feeding schedule, but also go over lots of education, probably starting with reminding you how small your baby's tummy are when they are first born. Because if you're formula feeding, you can actually overfeed your baby. And then think of how you feel after like Thanksgiving dinner and you're laying there all bloated. We don't want to give your baby gas or make them fussy. So lots of education there, but also on the different types of formula, because there are concentrates that you mix, there are powders that you mix, and then there are ready-mades, but also education on the safe handling of formula and the preparation of formula. And we still want to remind you that even though you're formula feeding, you still have to feed your baby around 8 times in 24 hours. Confession time. In postpartum, we are really obsessed with your pee. We want to know all about your pee because childbirth can actually wreak havoc on your ability to pee properly. Now, this is more common if you had an epidural, but you can absolutely have issues even if you didn't have an epidural. Maybe you can't pee at all, or maybe you can't hold your pee, like me, I basically peed on the floor, or maybe you can pee, but you're not fully emptying your bladder. And we really want an empty bladder for your postpartum recovery, because if you have a full big bladder, it's sort of in the same zone as your uterus, and your uterus needs that room to be able to clamp and contract down efficiently. And that contracting is actually what is helping your bleeding to resolve. So a big full bladder can actually make your bleeding worse, and then we would worry that it could turn into a postpartum hemorrhage. So when you come to postpartum, we are also assessing your ability to pee. We want to know that you can pee at least 3 times after you have your baby, of at least 200 milliliters each time. That way we know that things are functioning the way we want them to. If you have an IV in place when you arrive, the first thing I'm going to do is make sure it is working well. And then of course you're going to be like, Tina, when can this come out? So depending on why you have the IV in the first place, that depends on when it can come out. Generally speaking, if you had an epidural, you're looking at around 6 hours after birth. And if you had a C-section and a spinal, generally it's around 24 hours. But of course, if you need IV fluids or if you have IV medications, that IV should really stay in place. But you can always ask for it to come out earlier than those guidelines, as long as you are aware of the risks of losing your IV access early. You're also going to be asked to move around, especially if you've had a C-section, because we know that movement is really beneficial, especially following a surgery. It's going to help with blood flow and decreasing your chances of developing a blood clot and helping with constipation. So movement is really key when you are in postpartum. Just keep in mind with your flow down below that, just like the first day of your period, if you are sitting or laying down and then you stand up, you might have an initial gush because that blood while you were relaxing was just pooling in the vaginal canal and then out it came. But if you continue to gush, or your bleeding is getting more intense as the day goes on, or you are passing fairly large size clots, larger than a toonie or a loony if you are Canadian, please let your nurses know. And then other than that, your time is your time to focus on skin to skin with your baby, bonding, and starting your new journey. Now, moving back to baby, there are going to be 3 medications that are recommended to your baby after they are born. The first one is the Erythromycin eye ointment. This is the one given to baby within 24 hours, and it makes their eyes look kind of all shiny. Here is a big video on the Erythromycin eye ointment for babies because there's a ton of information, so if you have questions or concerns, make sure to give that one a watch. The next thing on the list is going to be the Hepatitis B vaccine, and if your baby receives this in hospital, it is going to be the first in a series of 3. And the last item on the list is the vitamin K injection. Now, this one is not a vaccine, even though it is given by needle. Now, there is a ton of information on social media, some of it good and some of it not so good. So I just urge you, if you are looking for information on vitamin K, really make sure that your sources are credible and that the information that you're absorbing is up to date. I have made my own video all about vitamin K. So if you are looking for some of that information that is evidence-based, you will find a lot of it right there. Your baby's also going to be assessed for jaundice within 24 hours after they are born. And if you've ever seen a baby with jaundice, they have kind of yellow skin and yellow eyes. But this is a non-invasive screening tool. It's known as a TCB, or a transcutaneous bilirubin. And we simply take a meter and we push it down on their skin 3 different times on their chest, right about here, and then that shines a light onto their skin and it gives us back a reading. Now, we let the pediatrician know what this reading is, but if it comes back elevated, chances are the pediatrician is going to want a blood sample to get a more accurate diagnosis. And that does mean that baby is going to need to be poked in the heel to obtain that blood. But you can absolutely have baby skin to skin or be breastfeeding baby with this poke to help them sort of deal with that pain a little bit better. Now, this heel poke is not only reserved for this jaundice test, but we also test for a whole gamut of metabolic disorders like PKU and cystic fibrosis, to name a couple of them. And it is done so that these healthy looking babies, if they do have a metabolic condition, it can be detected that much earlier so that you don't have to wait for symptoms to appear before you can start treatment. And if you have questions about any of this testing, be sure to talk to your baby's doctor. Guys, I cannot forget about my favorite thing. It is baby's first bath. Oh, I love baby's first bath, and it is probably going to be done right in the room with you. So it is a great opportunity for you to sort of sit back, take lots of pictures and videos of your brand new baby, and ask lots of questions. Guys, do not miss out on this prime opportunity for education. You have your nurse's undivided attention. It is one-on-one, so really, really utilize that. But your baby's bath will not be right away after they are born, because the World Health Organization actually recommends delaying baby's first bath for 24 hours, and that has a ton of benefits. It makes it so that your baby is better able to regulate their temperature and their blood sugar, and it leaves that vernix on their skin a little bit longer, and that vernix is a beautiful substance because it keeps their skin healthy, it protects them from infection, and it keeps them super moisturized. It is incredible. So those are the benefits of delaying the first bath. Now, when the bath is done, that is a great opportunity because your baby is probably going to be crying. Heads up, babies don't usually love their first bath. So they will be crying, they will be alert, they will be awake. Perfect time to get a nice solid feed in to enjoy some skin to skin time while they warm up from that first bath. If you are still with me, we have talked about most things that are going to happen during your postpartum experience, but there are still 3 things remaining on baby's list that have to be accomplished before they can go home. And the first one is they have to be seen by a pediatrician who will give them a really thorough head-to-toe assessment and clear them as a happy, healthy newborn who can go home. And the next thing is a hearing test. Now, this is actually really cool because they're able to pick up hearing issues with baby that wouldn't otherwise be detected until they are a toddler. And then the last thing on the list is something called a CCHD screening, which stands for a critical congenital heart disease screening. And they've actually found that around 20 in 10,000 babies have a heart defect that isn't otherwise picked up prenatally or when they are first born. So we do this screening test, which is non-invasive as well, to try to pick up some of those defects. It involves putting a sensor on baby's right hand and checking their oxygen level, and then right after that, or at the same time, putting an oxygen sensor on one of baby's feet and testing the oxygen level down there as well. And we're looking for a very small difference between the hand and the foot and making sure that those oxygen levels are above accepted ranges for that baby. There is one more thing that your baby needs, and that is a mode of transportation, meaning you need a car seat to get your baby home. Now, this car seat needs to be the right type of car seat, and all newborn babies should be in a rear-facing car seat unless they have a medical condition and they have a different type of approved car seat. It also needs to be certified in the country that you live, and it cannot be expired. Now, you're going to bring this car seat into the room, and you are going to put your baby in the car seat, and then we are going to check that that baby is appropriately and safely in that car seat for transport home. And it might be wise for you to actually have unpacked the car seat out of the box, and if it has a base, maybe already install that into your car safely and appropriately before it is time for you to go home. When it comes to discharge for you, if you had a vaginal birth, you can expect this to be around 24 hours later, and if you had a cesarean section birth, you can expect this in around 2 to 3 days. And when we come to discharge you, we're going to hand you a massive stack of papers. It's going to be completely overwhelming because you have so much stuff on the go already. My best advice to you is this: While you are in hospital or in the birthing center, keep like a running list of questions as you think of them so that when it comes time for discharge, you can be like, here are my questions. You don't have to try to go in your brain that already has so much stuff in it. And then take that massive stack of papers home with you, and when you are ready to absorb that information, start going through them. I really think that there are two important questions to make sure that you ask before you go home, and that is, what emergencies do I need to worry about for baby, and what number do I call if I have concerns? And you guessed it, what emergencies do I need to worry about for myself? And if I have concerns for me, what number do I call? I feel like I'd be doing you a disservice if I talked about the postpartum experience, but I didn't talk about baby blues and postpartum depression, because I feel like mental health in general, it needs more support and it needs more awareness, but we really need to talk about these things with brand new parents. So, baby blues. These are some of the changes in how you might be feeling around 2 to 3 days after baby is born. And it's usually reported as any degree of sadness or anger or feeling anxious or crying more than you normally would or feeling differently towards your spouse or even your other kids. But what one person feels, another person might feel something completely different, so keep that in mind. Now, baby blues symptoms, they are usually reported as milder and they should go away on their own, but sometimes they don't, or you might have an onset of symptoms that comes on a bit later, starting around that 1 or 2 weeks. Now, this could be postpartum depression. Now, these symptoms are usually graded as more intense than that of baby blues, and this is just an example of some of the symptoms that you might be feeling. And again, keep in mind, what you might be feeling if you are experiencing postpartum depression will be very different than what somebody else is experiencing with postpartum depression. So for this reason, it is really, really important to have good communication with your partner or your family or your friends so that you can keep them in the loop if you're experiencing any of these symptoms, because postpartum depression should be seen and assessed by a doctor as soon as possible. Now, if you would like a video about baby blues and postpartum depression and postpartum psychosis that goes into more detail, please let me know in the comments, and I am going to leave some resources in the caption. So that was a lot, but birth is a lot, and so are babies. And I'll tell you something else, your baby still has a few tricks up their sleeve. This is a video all about things that might surprise you about your newborn baby. So give that one a watch, smash that thumbs up, and I will see you in the next one. Bye.